right, so I'm pretty sure I have Achilles tendonitis on left Achilles. It's just because it's super swollen, comparatively.
Like kind of, yeah.
Yeah.
How long's it been going on?
3 months.
Has it gotten worse, better, stayed the same?
So I took about 2 months off. 2 months off. Like
and that was off of like what's
running.
Okay.
So like impact is like what causes the like most severity, pain, and discomfort. And I've taken off like soccer, running, anything.
Rotate up, and we want to think about creating space. Oblique sit. Swing the weight around. Do this little foot, and we think of a bunion having a little kick, right?
Spring off. I kind of feel a twinge. It's not bad. It's like very dull. Like I just feel it there. But impact doesn't really hurt. Stepping down can hurt. So anything kind of impactful like that.
And then
is discomfort.
In your record, I saw like high ankle sprains from soccer.
Yeah.
Is that both sides?
Yeah.
Okay.
Yeah.
Have you had any major lower extremity injuries besides that, like broken bones, surgeries?
Osteoid cancer popped out when I was in like 9th grade. So there's a little fracture there, but that was it. And that's fine.
And then prior to this flaring up, did anything change? Did you have any little like ankle sprains, or did you change intensity in any training?
So the it started right when I started iron track.
Okay.
That's what the big difference was, because I was running long distance, I was still playing soccer, I was still playing basketball, I was doing a little bit of football as well, like flag football, and then I started iron tribe, and so I started staying on my feet pretty much the entire day, and so I wasn't sitting down ever, and so I think doing iron tribe and then continuing to do all my other activities, so I'd still lift weights, I'd still do everything I could, and then adding iron tribe workouts on top of that, I think is what caused.
So you were doing a ton of like dynamic plyometric based stuff, just not as maybe as much volume. Do you notice it's any different with like different shoes, or if you're barefoot or anything?
No, I don't really notice anything there. I mean, I'm cautious of sprinting on it or doing things like I'm just really afraid it's gonna tear.
Okay.
And so I'm just
some fear avoidance there.
Yeah, okay. But I should let you know, like I'm gonna continue running on it. Yeah. For right now, because I have a Spartan race in 2 weeks.
Okay, perfect.
I do know I have super stiff ankles.
Yeah.
Because I assume the ankle sprains. I did go to the PT by my ankles.
Yeah, I saw you. Did you go to PT for this?
Yeah, for my ankles. Well, for my Achilles and then for my ankles as well.
Okay. Was anything really helping the Achilles in PT?
The Achilles, no. So the stretches help. Stretches definitely help. And that's been about it.
So I'm going to kind of talk about your gait so people can learn as we're going. So head on back down that way. So we see him go off of his left foot. Never really dives through pronation. He attempts to start and then kind of stays off in supination. You even see he likes to roll off on that outside. And then if we look at what he's showing for insertional Achilles tendinopathy, so if we have you stand that way, get kind of what's called pump bump, and probably a little bit tender at getting in closer to the insertion. And if we change like the vector of force, right? So if he wants to head that way, we're going to create more pull on one side or the other. And your Achilles is really good at taking linear force, right? Because it spins 180 before it attaches. But as soon as you start adding shear to a big tendon that creates sagittal plane force, it doesn't like that very much. And then towards the enthesopathy or the enthesis, you're going to get an enthesopathy because that kind of starts to like tug on that periosteum a little bit, and that's kind of what we're postulating. A bit of that kind of angle due to like how tight the cleats are and stuff like that. But that's probably where we're going to see some of this is, he's had high ankle sprains we took from his history. We're going to have probably a little more stiffness than we'd like in both first raise, but that's the kind of stuff we'll look at overall. So let's stand facing this way, go feet together. We're going to run through all these movements and just get like qualifications. So chin to sternum without opening your mouth. And then look back at the ceiling as far back as you can. Cool. And then look straight ahead, look over your left shoulder as far as you can. And then right. Good. And then head straight, go left hand up to right shoulder blade as high as you can. And then right hand up to left. Good. this stuff, just tell me if there's anything that's painful. I doubt it is. And then right over top left. Cool. And then keeping your knees straight, go down through a toe touch as far as you comfortably can. And then back up. And then arms up overhead, bend back as far as you can, push your hips forward in space. Good. And then arms by your side, feet stay together, rotate your whole body to the left as far as you possibly can. When you get there, we're going to take a deep breath in and out. Cool. And then switch. Let's go left one more time, Lynn. Cool. So we'll explore that a little bit further. Let's go left one more time. So we see a couple things, not the symmetry we're seeing on the right, and then you can see that here he dives back into supination on this side to get there. So we think maybe that old hip injury is driving some sort of like compensation or fear. Cool. And then right foot stays down, left leg up off the ground, just looking straight ahead. And when you're ready, you're gonna close your eyes. Try to get 10 seconds eyes closed. Just keeping those arms chill. A little bit of rocking is normal. Cool. And relax. And then left foot down, right leg up, eyes open for a little bit. And close when you're ready. Really doesn't like loading the first MTP like really at all. So that's probably where we're gonna get the biggest bang for a buck. Cool. And then let's go feet together. Try to keep your heels down on the carpet and just go down through a squat as far as you comfortably can. And just get whatever you got. Yeah, it doesn't matter. And is there any pain or discomfort just doing that? Cool. And then go normal squat width and just give me a couple air squats. Two more, man. Good. Actually, one more. Cool. Then rotate to the ceiling. Cool. And then switch. And then I'm going to see, because he's a little bit restricted there, if I can pull him further than he can go, which is the case for sure. It's a little bit of motor control.
It made me addicted to it. Like I had to like go do it again immediately after to get like another rush.
How have you been doing it? Like do you?
Oh, really well.
So you kind of like look right over the top of his foot just real quick. So again, this stuff is all just kind of like observation. We're not like dictating anything off a singular finding, but when we load him into ankle dorsiflexion, you can literally just see like FDB and flexor hallucis longus just like jump out at us from a tendon standpoint. So when you start changing the vectors that this is going to work off of, everything has to work a little bit harder, right? And that's where people can get some discomfort in here. And then we got to think about how flexor hallucis longus runs right up into the kind of like same area almost as like insertion posterior tib. Any pain just loading that ankle. And then what we're really going to work on with wind is we need to increase big toe mobility. So the windlass effect, do you know what that is? We'll call it just the wind effect today. The windlass effect is when I wind up the big toe and I wind up the ankle to create the stiffest position of the Achilles to plantar fascial complex. So just think this is one big piece. If we cut that piece of fascia off, we could hang a car off of it, right? Super strong. So then if he can wind that up, he gets a lot of elastic recoil. What he's getting right now is he's having to work extremely hard through here, and then all the stretch is coming from here. And that's happening because he's not able to get into the position to create elastic recoil, hence why jumping and like pushing motions take him to the end of his kind of soft tissue stretch through the ligament, which it's not meant to load like a slingshot here. This is supposed to stay isometrically contracted, get the end range, and let go. So he's just kind of loading the snot out of one side of that for a couple different reasons. So we're going to do a tiny bit of soft tissue through his foot and maybe a little bit just to calm stuff down, because pain relief is a big deal and he does have a little bit of swelling. So believe it or not, we do some hands-on stuff here too. And his foot stuff that he's trying to roll is always going to come back, right? If we don't give him like access to movement and then control that movement. And that's what I think a lot of people are going after with like trigger point work, right? We're rolling something that's working for a reason. And it's not bad to try to get rid of the tension or the pain because we want to feel better. But at the end of the day, we got to ask the kind of secondary question of like, why is that thing getting wound up? So there's 3 rockers of your ankle, right? First rocker is kind of when I hit my heel. Second is kind of moving through midfoot. First is going off big toe.
Yeah.
So when 1, 2, 3, like that. When I walk, I use all 3.
Yeah.
When I run at a moderate pace, I use 2 and 3, right? When I sprint, I'm just using 3.
Yeah.
So if I use 3 for 8 miles, stuff's gonna get angry, whether that's count. So I was talking earlier, there's a little bit of stiffness in that left hip. I don't think that's a huge driver for him, but something to work on beyond this for sure. And the other thing is, we don't need stuff to be perfect, right? We don't need perfect ankle dorsiflexion. We need it good enough to accomplish the task. And maybe having a minute buffer, right? So I'm not hitting the very end of my ankle or my big toe every time. Just gives me that little bit of injury protection. Big goal today is that big toe, man. So my goal today is not to make your toe look perfect. It's to increase the mobility enough to where your brain's going to say, man, it's much easier to go through my big toe, get my ankle a little bit better, and now I use this position to run right off the front of my foot, right? Go kind of outside heel to inside toe, rather than go
right. I definitely run like that.
Yeah, and you can 100% change that.
Okay.
Right, and that's just accessing a little bit more here, a little bit more here, and then let's say you get better mobility in both of these. That may be a scenario where you still have to coach running because you have the access and you're just not doing it because you're hardwired to do that.
Right.
That's where I change the gait. Does that make sense?
Yeah.
Push your big toe into the door frame as hard as you can for about 20 seconds. So this would kind of be like functional range conditioning stuff, like a PAILS. And I kind of call it, we'll have you walk twice, Wayne, just so we can kind of see. So the other thing that you're going to see, which is actually an improvement, is we know Wayne likes to go out, but it's almost like he's putting a cigarette out under his first MTP, so we're starting to actually get a little bit of spin into that foot, which is better. Some people are like, oh, that's what we're working on, but now we're starting to move through that toe as well.
Yeah.
But I want you to feel pretty confident that like the risk of rupture for you is going to be dependent on a lot of other factors like sleep, nutrition, hydration.
Okay. Yeah.
Does that make sense? How the tissue quality.
Yeah.
Then also your age. You got a big benefit there. Number 1, acute injury in men over 40 is Achilles ruptures because they sit on the couch and then they're like, I'm going to go to basketball.
Right.
Or go start doing box jumps. But it's also like, you know, are you building resiliency into all those tissues through strength training, plyometrics? So I feel very confident that like it may get angry. But we're gonna see you next time, okay? When you have vibration, you're going to affect some of the receptors in your skin and underlying tissue. When I do that, I get more feedback, which seems counterintuitive because usually if you use vibration, you feel like numb and kind of move and don't feel it. And that's why the range of vibration matters. It's not just like more is better. It's like certain frequencies. So like at 30 hertz is the exact same vibration that comes back at you if you were running like concrete or asphalt. Right? Really? It's the same vibration that comes back at you. Is making sure that your heel always points directly to the ceiling, that we're not going to deviate inside or out.
Okay.
And then if I said, hey, let's just test and try to sit back onto your heel, and if Daniel comes over here, we're going to see the ideal world, we would get the ball of wind's foot to the ground. And now I'm going to happen, he's going to say, whoo, super tight through here. Okay? Lift and hold for about 3 seconds. And pause. Could you feel how you immediately went out to those lateral fours? So you're going to have to almost feel like you pull your foot in to that big toe and then relax. We're going to do 10 reps. And I'm going to be kind of challenging here a little bit, okay?
Okay.
So don't let me win. There you go. That's what you want to feel, okay?
Okay.
So again, he immediately went like this on that first lift. That's his like go-to. And no pain doing this stuff, correct?
Right.
Driving through his toe, feeling like his ankle has to work. Yeah. hips a little lower. So we gotta move, more through your ankle. There you go, that's what I want right there. Yeah, I'm gonna get my heel down. So now we gotta load that big toe big time. Okay, take a little break, and then we're gonna flip sides, push the box back. Does that make sense? So if I'm lower here, it's almost like a split squat.
Yeah, that's a lot harder to my heel down, for sure.
There you go. Drive through that big toe. So load it. Good. Perfect about any of this stuff.
No, that makes sense.
Okay. So I know I said I was going to tape. I don't think I'm going to. I don't think we need to. Because you don't really have pain outside of just like impact.
Yeah.
It's like, let's just let you kind of roll with it. And then if anything really barks at you, obviously cut it so we're not going way backwards, way forwards. Just like trying to hit it good path.
So, right, like, because like you said, I evert a lot.
Mainly on this side, a little bit on both, but yeah, over here you just kind of like to roll off the outside of your foot, right? It's an easier path. It's like think of a river, right? You throw a big boulder in it, it just goes around it, doesn't cut it right in half. But the thing about our body and movement, if you groove that path for too long, like I said, you can get that big toe moving, you're still going to go that way. So you don't just like, the water doesn't just go through the toe. Sound cool? And then be barefoot as much as you can. That's huge. Shoes are great, but being barefoot allows your feet to work like a foot. And what you're going to see, if we get this toe working, that space will increase a little bit as we start moving through the first ray. And some of this bony overgrowth, review, Steven. But yeah, our whole goal is this, a little bit of that.